Hey there, Sono peeps. Want to go over this case real quick. Did another Nutcracker syndrome, Nutcracker phenomenon. So here we are axial on the CT. You see the aorta right here, SMA, so superior mesenteric artery, aorta. And here's the left renal vein, right? Usually it goes between these two. And you can see how it's kind of tight here, and then it gets a little wider right there. It's a little distended as it goes down into the renal hilum here. So left renal vein is a little distended. And here it looks collapsed. All right, so in sagittal, you're going to see the aorta right here. And then the SMA right there. So aorta, SMA, and then the left renal vein should be going here. Normal position. As it leaves the aorta mesenteric region right here, you'll see that it starts to get more dilated as it goes to the left kidney. All right, then finally we'll see in the coronal view right here, you can see the left renal vein right there as it goes and traverses to meet the left kidney at the renal hilum. You could also see the gonadal vein right here. So this is a gonadal vein. Remember, the left gonadal vein or testicular vein in boys would go into the left renal vein. That's why varicocele are more common on the left. And then the right gonadal vein goes towards the IVC. All right, so it's prominent. No pelvic congestion though. And then here you already see the aorta, SMA. And then the left renal vein should be in this region right here. So try to get the best, the GE machine really doesn't have an angle packet. So I had to use the infant angle in order to get the angle for the aorta. And here's about 18 degrees. This is the part we're really worried about, because the SMA juts out this way and then it starts to go parallel with the aorta. So you want this angle right here. And normal angle is about 36 degrees and up. Here you see it's 18 degrees, so quite acute. There you see the vein right there. So a color, superior mesenteric artery, aorta, and then the left renal vein. All right, so I try to get some flow in the left renal vein, but being that it's so close to the aorta and SMA, you're getting a lot of background noise of the arterial pulsations. So transverse is where you really want to show it well. So here's your aorta, vertebrae, aorta, superior mesenteric artery, and then here's the left renal vein. You see it's pretty squished and pinged right here, and then it dilates a little bit more as it goes to the left kidney. So you want to measure from here to here, and from here to here, and there's also a compression ratio that you want to get. That's pretty predictive of Nutcracker syndrome or Nutcracker phenomenon. So you want to divide the anterior posterior diameter of the compressed vein to the uncompressed portion of the vein. This case resulted in a compression ratio of 2.55, which is over 2.25, which is predictive of Nutcracker syndrome or Nutcracker phenomenon. All right, so you also want a Doppler here and here, and here you're gonna have higher flows than here because here is kind of like acting like a stenosis. So there you can see the flows. You got these areas here, but it's about 77, and then over here with angle correction, it's about 17. So quite a difference. All right, I did it again, 84. Okay, so again, aorta, SMA, left renal, and then again, the aorta mesenteric regions with the dilated left renal vein. Wanted to share it, right? Take care. Bye.